Great. Okay. So before I begin my presentation, I just want to remind us all about why we're here. Back in the spring, you got an email from Barry asking you to share with us how your healthy eating and active living activities had evolved in response to the COVID-19 pandemic. We ended up receiving responses from over 2/3 of all the coordinators, which was just great. So thank you all now for doing that. The richness of that data is sort of what inspired us to have this meeting today, and was just great information on the strengths and strategies and reflections on how mass promotion approach informed your local response work. So thank you. We'll share a little bit more about that data and how we began to make meaning from it in just a little bit. Alyssa will share that with you. But first, I wanted to reflect on what we're going to be doing today and talk a little bit about data analysis. So I'm going to try to share my screen, and you all can let me know if I'm successful in doing it, because I feel like I'm over a year into the pandemic and still learning how to use Zoom. Is that coming through correctly? Do you feel like, okay, good. I didn't want the version where you have my little like Zoom chats popping up in it. So we're here today to do some collaborative inspecting of all that survey information and making meaning of all those great responses. Oops, but now I can't advance my slides. Can I?
Sharon, sometimes if you click on the screen and then use your keyboard,
it will work better.
Sometimes that does for me.
Okay, let's see. Sorry, hold for my technical difficulties. I'm going to stop sharing and then reshare and see if that works better. We might just have to use the Outlook. Okay. You can see my screen. Let's see if this works. Great. I'm going to move the participant stuff off. Has that advanced? Did I do it correctly the second time? Okay, great. So before jumping into how we make meaning of data, want to talk a little bit about what is data. So data are facts about things. There are generally two categories of data. Quantitative data, which is measurements, numbers, things you can count or quantify. This is typically when people are thinking about data, what they're talking about, what they're thinking about. But there's another really important source, which is qualitative data. Narratives, experiences, perspectives, feelings in people's own words about research questions or an experience. While quantitative data is really important for answering questions about who, what, when, why, who, what, when, and where, qualitative data can get at all of those questions, but can also go a little bit deeper into the why and the how, which is something that you often can't really get to with quantitative data. But whether you're looking at qualitative or quantitative data, the important thing is that data is facts that can be analyzed. And by analyzed, I mean the process of cleaning, organizing, inspecting, and even transforming that information in some way to answer a question that's motivating your research or why you asked to collect data in the first place. So in this case, we asked 4 questions via an email survey. What activities have you been advancing in fiscal year 21 in response to the COVID-19 pandemic? What activities are you most proud of? In what ways have these activities focused on your priority populations, and how have partnerships changed during COVID-19? We received quantitative data in response to these questions, and that took the form of 14 written responses and 3 transcripts from interviews. So a lot of rich text data, and in some cases, coordinators even sent supportive documents. So there was a lot of material for us to look through and start to find meaning in it. So when we are approaching qualitative data, like all of your survey data, we typically take 3 very basic steps, and I'll dive into each of these in short, but they are reading through the data, labeling codes, and then building themes from those codes. So reading through your data, this feels obvious, but it's an important step to take. It's just reading through all of the information that you've collected once. And as you're going, just noting down for yourself patterns, surprises, what you're seeing, so that you can refer to it after. Because the next step is when we start thinking about making meaning from this data, and it's labeling codes. So codes are short 1 to 3 word labels for pieces of information, interview data. The labels are meant to capture and summarize the main theme from the perspective of the research question, with the goal to kind of strike this balance of staying close to the interviewee's words as possible, while also trying to find universal codes that can apply on to multiple interviewees' data. So you're trying to balance being true to the respondent while also trying to find a way to organize and identify similarities or differences across each of your different responses to your research question. And why are we doing that? As my last explanation alluded to, coding allows us to organize interview responses in order to systematically explore the data. Analyzing codes in this way can help reveal themes and patterns. And all of this is towards building themes. So if codes are the building blocks, themes are the structure that we're building towards. They are groupings of similar codes or codes that coincide with each other frequently, and they're meant to capture relationships amongst the text that has been coded, which allows us to sort of make meaning from all of these disparate responses and start speaking towards findings that are greater than one individual interview. So all of that is to say, when we're coding and finding themes, we are creating a system by which we can link data to meaning. And so today we want to engage you in, we've already assigned the codes, so we've done step 2, and we want to engage you in step 3. So looking across data that has similar codes and helping us build those themes. And just to show you what that's going to look like and give you because I realize it's kind of abstract, this quote is from one of our mass emotion respondents, co-coordinator respondents. And I might ask someone to read it for us. Dawn, I see you on my screen. Do you mind reading this quote for us?
Sure. I believe we were successful in being representative of our priority populations, thanks to our community partners. Am I in the right place?
Yes, you are.
Okay. From the AAAW to Haitian Outreach, Portuguese, Latinx, and multiple Asian organizations. It was posted on the city website in multiple languages. As well as boots on the ground with my network partners. I would be remiss if I did not mention the Greater Boston Food Bank and the enhanced relationship we have created. They were instrumental in funding our survey.
Thank you for that. Allow me to rest my voice. So yes, so what you're seeing here is an excerpt of a coordinator describing what we coded as a new activity. So if you look all the way to the left, this entire paragraph was coded by us as something new that happened during COVID-19. But within this new activity, our coder also identified other codes that were related to our research questions, which were how did people align themselves with mass emotion approaches, and how did they engage priority populations or work with new partners. So you see here in this section that's highlighted in pink that the coordinator spoke about priority populations, and the way that they spoke about engaging priority populations sounded to our coder as collaboration on that sort of spectrum of community engagement. We also noted that the identification and engagement of specific priority populations does align with the mass emotion approach, so we tagged that. And that in this case, the coordinator was specific about which priority populations they engaged. In this case, it was people of color and immigrants. We also noticed in the blue section that the coordinator was talking about working with partnerships. In the blue case, it wasn't specific about what types those partnerships were, but in the green highlighted section, we saw added specifications. So it's working with partnerships, in this case, the Greater Boston Food Bank, so a community-based organization. And they referenced that this relationship was enhanced or strengthened during COVID-19. So this is what we were doing when we were coding, was big blocks and then sub blocks to identify different things that were going on in the data. So I'm going to exit out and stop sharing my screen. But before we dive a little bit deeper into the response data and see what we pulled from all of that coding exercise, I might pause there to see if anyone has any questions that they want to drop in the chat. And also if anyone has reflections on how they've used community input to inform their work or looked at data like this before and had it inform their projects. I'm going to take no questions in the chat as an okay to move on, Alyssa, if you're comfortable sort of jumping into the local COVID response data.
Yeah, that sounds great. Let me share my screen, hopefully learned from how you shared yours. Okay. Can we see the right screen? Can we see just the presentation? Or are you seeing lots of tabs?
I'm seeing just the presentation, but not in presentation mode.
Right, that's correct.
Now it's in presentation mode, it looks great.
Wonderful. Great. So as Sharon mentioned, we did some initial analysis with your responses last summer. And so I want to take this opportunity to walk you through our approach as a framework for moving on to the collaborative data analysis activities that we'll do in the breakout groups. And also to just sort of familiarize ourselves with this data set, what the data looks like, and really appreciate the richness of the data that you all provided. Great, so I want to just sort of reorient us here in the goals of this research and analyzing your survey responses. So I'm just going to read these briefly to situate us here. So the first research goal was recognize heal activities emerging in response to COVID-19 pandemic over time. And 2 was identify opportunities to connect immediate work to possible permanent change. So with this, we had 3 research questions, which I'll breeze over since we talked about this with Sharon, but to remind us, so what local COVID response heal activities are coordinators advancing in fiscal year 21? How have partnerships changed during COVID? And to what extent have coordinators applied the mass in motion approach to their COVID response work? So as Sharon alluded to in her introduction presentation, Qualitative data analysis uses codes as a process of sort of systematically categorizing what you heard to find themes and patterns. And essentially, it enables you to take unstructured or semi-structured data like transcripts or focus groups and create structure from it. So, it's one thing, as we talked about with quantitative data, to look at the number of dollars spent on a program or the number of attendees at a certain event. But collecting qualitative data provides a richness and allows for nuance in a way that quantitative data often might sort of breeze over or obscure. So one of the benefits of doing the analysis of qualitative data this way is that it makes it more systematic and rigorous, and it helps mitigate your own bias as you're reading through people's responses. And it also provides transparency about how you went about understanding the data. So just to sort of recap these steps, sort of these very broad steps that Sharon talked about, we read all your responses. We then went through and labeled all of the data with the codes that Sharon showed in that example of that text. And then finally, we would look at all the codes as a whole and build themes around those. So now I want us to take a look at the code book. So this is essentially a way to keep organized during this process. And I'm hoping that this might give us a better sense of how we began to understand your responses. So in the dark yellow boxes are the larger themes. So we have HEAL activities, priority populations, partnerships, strategies for engaging priority population, mass in motion approach, and adjustments to COVID. And so I know that this is sort of busy slide, but I want to sort of break it down so that we're understanding. So the yellow boxes, like I said, are the larger themes. And then the black text under the boxes are sort of these sub themes. So for example, as Sharon talked about in her example, a text excerpt may be coded as food distribution under HEAL activities and elderly under priority population. And so these aren't mutually exclusive, as she showed in that text. So it's sort of as many or as little codes that feel relevant to the subject matter in the text that you're looking at. So we went through this process and pulled out some themes that we noticed. These are not definitive, but some of the ones that stuck out to us. And so we thought we would go through these with you. So the first was around food distribution. It was the most common new activity for mass in motion coordinators during COVID, and it seemed to primarily target priority populations. Community engagement was also a major activity, and it contributed to needs assessments, determining how resources should be used and prioritized, and education. There was also new and strengthened collaboration, particularly among community-based organizations. And finally, while some of the response work seems to be guided by the mass in motion approach, it doesn't appear consistently across all mass in motion coalitions, and that's something that we'll talk about a bit more in depth in a moment.
Alyssa, there's a question before we jump into
Yes.
these findings in the chat.
Tell me.
Can you explain the order of the code book? Did the themes come first or the codes?
Yeah, that's a great question. I'm gonna go back. Okay. Yeah, that's a great question in terms of the order of how we approached it. I think we took the larger yellow boxes as sort of speaking directly to the research questions that we had. And so we wanted to make sure that the way that we were coding and understanding the data was responsive to these specific questions that we wanted to ask. From there, we went through, read all the data, and pulled out the black text as sort of what we thought was most prominent in under these yellow blocks. But we did go through a process of sort of reviewing the code book. We sort of made a draft code book and then went through one survey response and used that and sort of saw, was this sufficient? Were there any gaps? Are there codes here that don't make sense? And edited it based on that until we finalized a code book and then applied that to all the other responses. Does that answer your question? I'm sorry, I can't see the chat, but whoever asked that, does that answer your question? Great. Okay. Thanks for that question. So at this point, let's go through each research question and share some of our observations. So the first research question, again, was what local COVID response HEAL activities did coordinators advance in fiscal year 21? So this chart shows the results of how we coded your answers. So on the left, we have the HEAL activities. These are the same ones from the code book slide that we were just talking about. And then on the right, we have the number of mass in motion coalition that mentioned this particular HEAL activity at some point in their survey. So for example, if a mass in motion coalition is listed under food distribution, it's because there was some point in the response that we coded as being related to food distribution. So we can see that the top two are food distribution and task force creation and collaboration, followed by educational and resource materials and community engagement. So I want to highlight a couple quotes for each of these codes just to sort of illustrate how we're understanding and things that we felt like really sort of illustrated this particular code. I'm gonna read them out loud, but maybe for the next research question, I will find somebody to read them for me. In August 2020, Cape Ann seniors on the GEO partnered with Gloucester COA, Senior Care Inc., Cape Ann Farmers Market, and our transportation provider to distribute fresh local produce to older adults in Gloucester. This took the place of annual senior farmers market vouchers. We were involved to reach low-income seniors specifically. The next one, the meal kit boxes have been distributed to Black and Brown families living within MPDC properties, some of who have been identified as being food insecure. So from here, we want to share some of our observations around this code. Again, these are not definitive, it's just sort of our interpretation. So in comparison to other HEAL activities that we looked at, food distribution was one of the most frequently mentioned among the mass in motion coalitions, as I said in the previous slide. It was also the most mentioned new activity and the most mentioned activity that is directly aimed at priority populations. So it seemed to us that a common approach to food distribution was to increase accessibility by eliminating barriers to reaching food. And of course, this then begs the question of whether this is a temporary adjustment to avoid gatherings or if it was a permanent shift. And this is sort of an example of how we're hoping that you all can chime in today with some context and insight. So research question number 2, how have partnerships changed during COVID? So looking at this similar table, we have all the different partnerships that we saw mentioned in the responses, and then the number of mass in motion coalitions that mentioned having a partnership with one of these entities. And here we see municipal and community-based organizations at the top, followed by healthcare and schools. Can I get a volunteer to read one or both of these quotes, depending on how ambitious you're feeling?
Alyssa, I'm happy to start us off with the first one.
That sounds great. Thanks.
The first quote was, "Partnerships were established and strengthened with organizations working directly with priority populations, built relationships with organizations serving communities of color and the Latinx communities, and networked them with already existing food distribution channels." Anyone want to take on the second quote?
I'll do it.
Thanks, Rachel.
Our partnerships with food assistance organizations and housing have strengthened, and their relationships with each other have also strengthened. At the outset of the pandemic, Mayor Driscoll created COVID teams to focus on priority populations, that is, food security, housing, seniors, homeless.
Great. Thank you so much. So transitioning us into the observations here, we saw a marked increase in collaboration throughout your responses. So task force creation and collaboration was one of the most frequently mentioned HEAL activities, in addition to food distribution, among participating mass in motion coalitions. And the most frequently mentioned new partners were community-based organizations and municipal entities. Many participants mentioned strengthened partnerships. There were a couple that mentioned weakened relationships too, and that was mostly just due to the lack of in-person collaboration. So research question number 3, this is the last one. I know we've been doing a lot of talking here. To what extent have coordinators applied the mass in motion approach to their COVID response work? So here for the codes, we use the different mass in motion approaches, and we see the number of mass in motion coalitions on the right that applied that approach according to our coding. So we see that the top ones were fostering of multi-sectoral collaboration and identification and engagement of priority populations. Okay, so we have 2 more quotes. Who's going to read them?
I can read one.
Thank you.
Extending the Hudson mobile market to community members, most of whom speak Portuguese and have limited transportation. The program is being run almost entirely by volunteers, including 3 who speak Portuguese and have been able to reach out to this population that has been hard hit by COVID.
Thank you so much. One last volunteer.
I'll read.
Thank you.
Revere COVID-19 Community Response Network was launched in March. A network of City of Revere staff, community organizations, faith leaders, business owners, and residents who are organizing COVID-19 outreach and wellness efforts for our city's vulnerable populations, businesses, and all impacted by this COVID-19 emergency.
Wonderful. Thank you so much. So this one, we struggled with having sort of clear themes. We already talked about the most frequently mentioned mass emotion approaches. We also attempted to code on the continuum of engagement, from inform as the lowest form of engagement to community driven and led as the highest form of engagement. It was difficult to determine from the data provided exactly where on the continuum each activity fell. And given that caveat, most engagement activities were coded to the lower end of the continuum, so inform, consult, and involve. This result doesn't necessarily signify that more engaging activities weren't happening, but it was, but I would say that all approaches had sort of mixed result and varied based on the mass in motion coalition. And I think that this is a really good reminder of why we're doing this activity today. is that we're sort of sitting here at our desks interpreting what you all said without really knowing what's happening on the ground. And so, you know, we come to you for you all to shed some insight onto what's happening, and perhaps things that we're feeling, you know, not so clear to us. You might have really different interpretations, and we're really curious to hear that from you all. So that's sort of a broad summary of how we went about coding the data. I'm happy to answer questions depending on where we are in time or move forward, but I will hand it back to you, Sharon.
Great. I'm going to stop the recording at this point. So